Okay, so welcome to this session on Buccolam. If you are working with a service user or any resident that has a diagnosis of epilepsy or status epilepticus, there is a chance that they're going to have emergency or rescue medication. That rescue medication is normally Buccolam, and it is medication like any other medication. So before we get started on the medication, because actually the administering of it is relatively quite straightforward, it's all the background information that we need to be aware of. So what we need to make sure of, if we have a service user who has a diagnosis of epilepsy, there must be an emergency care plan in place and a separate care plan for epilepsy. Now, what you might have is something like this. So this is a patient instruction emergency care plan for the ambulance service. And what you have is the details of the service user up here, the instructions on what needs to be done, and the steps that you must take in an emergency. And that's because status epilepticus is a life-threatening condition, meaning it is for people that have seizures that last for more than 5 minutes. Now, those seizures could be tonics, clonics, full seizures, or alternatively, they could be absences. Now, you should have done through grey matter, and I'm sure Wagner will correct me if I am wrong, but you should have done your epilepsy training through grey matter. So this shouldn't be a new topic, and we're not going to go over what epilepsy is, because you should have already done that. So this course purely just looks at the management and implementation of the emergency care plan. So what you should normally see is if a service user starts to have a seizure, what you might see is that blank look on their face, their head may tilt to one side, the eyes may roll up, and they may start babbling or maybe not talking at all. So that's kind of an absence that they've gone into. Alternatively, you may start seeing the left hand shaking or the right hand shaking and kind of it going up and around the body. So that's going into a full tonic-clonic seizure. The most important part of this is timing the seizure. So when did the seizure first start? And that's because the interventions are time-bound, and they're time-bound based upon how soon certain interventions happen. Now, in adults, it is normally 5 minutes after the seizure has started, you consider doing the medication. And ultimately, what you're looking for then, sorry, I'm just muting everybody, what you're looking for is you're going to want to know where the emergency pack is, you're going to want to know where the emergency care plan is, and you're going to want to know the patient-specific instructions. So here you can see you've got patient-specific instructions, and what they have from the ambulance service, this is like an emergency 999 priority. So in other words, when you ring them up, you just say, I've got patient-specific instructions. You give the number on the card. So it's normally at the top, somewhere up there. You give that number, and what it means is that they're able to see the instructions. And that's because the moment you give one of these midazolam, the clock starts ticking, and then the next intervention has to kick in, and so on and so forth. So we'll talk about a standard protocol, and then from there, it's down to you to be curious about what each patient's protocols are. So you must look for that care plan. If we do not have that care plan, we simply should not be left alone with that service user, because we have no idea how to treat them. And if it goes wrong, it will go wrong really quickly. So let's just talk about a standard protocol. Somebody starts to have a seizure, they're an adult. We're going to get the clock, we're going to start watching, we're going to clear the space around them, allow them plenty of space to have their seizure. We're not going to hold them, we're not going to restrict them in any way, we let the seizure carry itself out. So we're going to try and make the area safe around them. As the seizure is happening, we're going to call for help, and we're going to ask for the emergency pack. Now, the emergency pack, hopefully it's in a standardised place. If you don't know where that is, you need to find out where that is, obviously. From that, you will then get the pack. And when you get the pack, you're going to keep timing. And then after 5 minutes has passed, you're going to follow the protocol. Now, these are already pre-filled syringes, so you don't need to worry about drawing medication up. They're already there. And what you're going to do, you're just going to check it, make sure it's prescribed for the right person. So you've got their name, you've got the dose, and you're going to check on the top the expiry date. So it's there. Now, if you forget how to administer buccal, they have the instructions are on the pack. So you can just open that up and the instructions are there. So if you forget what you are doing, don't panic, the instructions are there. All you're going to do is you're going to open up the tube and you have your syringe inside. So just make sure that you've got the right dose that aligns to the PRN medication. What you're going to do as the patient is laying down, it's called buccal medicine because the medicine goes into the buccal cavity. You're going to take the cap off. Okay, so you're going to take the cap off. And what you're going to do is you're going to pinch the cheek. You're not going to put your hands in, pinch the cheek. And you're going to put it right into the buccal cavity. So right down the back. So it's nice. Can you see there? So it's going to go right down into the buccal cavity. And then you're going to push gently half, give that a rub, and you're going to go the other side. You're going to pull, you're going to go into the buccal cavity, and you're going to push the rest in. So you're going to pull the cheek, slide it in, and inject. Now, if you struggle getting that in, just do it in one side. Put the whole dose into one side. If you can do half and half, it's better because it disperses around the body a bit quicker. Once you've administered that buccal, keep an eye on the clock, maintain the airways, make sure they're still breathing, check for signs of recovery. And hopefully after no more than 10 minutes, the seizure should be over. So 5 minutes, you inject, wait another 5 minutes, and hopefully that seizure's over. Now, it may be the case that the seizure is still going on because they have status epilepticus, which means prolonged seizures. And these are the ones where you can have sudden death syndrome attached to them. So it's really important that you know what the next steps are. What do we now do if the buccal hasn't worked? Because there is a chance the ambulance is going to take a long time to get to you. Now, they may have another medication. They may have a diazepam for rectal. They may have a medication called paraldehyde, which again is rectal. So if you have rectal medication, again, that's different training. We're not going to cover that on here. But if you have it and it's in that care plan, you need to let us know and we'll deliver that training with you. Now, what tends to happen is you'll have a pack of 4 of these. So you'll have 4 buccal midazolam tubes in a box. If after 10 minutes nothing's happened and you don't have another rescue medication, you're normally, you can give a second dose. Now, you can only give that second dose if the ambulance has arrived. Okay, so it's really important that you do not give that second dose until the ambulance is there. And that's because a second dose of buccal can cause respiratory depreciation. So in other words, they can stop breathing. And obviously you don't want that because if you haven't got your advanced life support stuff, if you haven't got your defib and stuff like that, you're going to be in trouble. So that's meaning if you are working with somebody with epilepsy, your basic life support certificate needs to be up to date and your AED certificate needs to be up to date. Now, let's say the second buckle's been given, the ambulance crew's there, they're going to watch them, and then what will happen off the back of that, if the ambulance, they'll have their different drugs, they'll be able to follow the rest of the emergency care plan. And what tends to happen in these emergency care plans, they have a plan for up to 45 minutes before they're normally induced into a sleep state. And that's because if a seizure goes on for more than 45 minutes, the body just can't cope with it. So I'm just going to recap on everything so we're all clear and aware of what we're doing. If you are working with a patient who has epilepsy, you are going to check where the epilepsy care plan is. You are also going to ask for where is the special instruction sheet, because this is your priority call for an ambulance, so you need to make sure you've got that. You must know where the rescue medication is. Where is the buckle? Is it in the house? So if you take the service user out to the community, if you go out shopping, you must always have 2 lots of medication with you. You follow your normal first aid principles. If they're having a seizure, you do that, you start timing. If in the care plan they're an adult, it will say after 5 minutes of a seizure, administer the buckle. You're going to get your buckle out. So you get your buckle. You're going to do your normal medication checks. Is this for the prescribed person? Is this the right dose? Is it in date? The right route? You're going to take the cap off. So this is pre-filled. You don't need to do anything with it. You're going to pull the cheek out. You're going to go into buckle, right to the back. So you can see how far in that is. That's where it's the whole way in. And look, right into the gap, right into the buckle cavity. You're going to push that in. If you can do half and half, brilliant. If you can't, just get the whole lot into one side. Now, obviously, they may be sick. Some may come up. You may lose some. There's nothing you can do about that. You can't give more. It's just unfortunate. Hopefully, they'll absorb it. You're now going to monitor them. And then after another 5 minutes, that's now 10 minutes since the seizure started, there may be a second intervention. That may be a rectal medication such as diazepam, or it may be paraldehyde. If you can administer that, you'll administer that. But if you do that, that's a second training because you need to be taught how to do rectal drugs. And then finally, if the ambulance is on its way and the ambulance is outside, you may be able to give the second buckle if after your 10 to 15 minutes. So if you haven't got a second one, or if you have got a drug in the meantime, you can give that dose, but as long as the ambulance is there, because of respiratory depreciation. Therefore, you must be ready to perform CPR. You've got to keep an eye out for your advanced life support stuff and just be ready for that. So, anybody have any questions regarding what we've just covered? Does that all make sense? So you must make sure you've got your care plan. You must make sure you've got your specific instructions. You must make sure you know where the buckle is, and you must make sure that you know what to do. Be mindful that in a 24-hour period, there are only so many of these you can give. So if you've already given buckle in the morning and that stopped the seizure, then by the afternoon, you may be in trouble, because if they have another seizure that day, you've got to make sure that you've got enough medication to keep them going. So be mindful about if somebody's having multiple seizures, what does that look like? And equally, if somebody's having lots of absences, what does that contribute? What does that look like as a seizure? So if somebody has a cluster of seizures, like up to 5 minutes worth, then sometimes that counts as a full seizure. So what we're saying is you must know that care plan. And if there is not a care plan in place, and if there is not an emergency specific instructions in place, you must tell us straight away, because it is not safe. Okay, I cannot stress that enough. So That is all you need to know about Buccal and Buccolam Training. It is a medication that helps people to sleep. It puts out the fire in the brain, if you like. It's normally quite effective. Be mindful if you're working with children. If you're working with children, sometimes the instructions will be to give it after 3 minutes and not 5. So there's no blanket rule here. You must just make sure you understand those instructions. Does anybody have any questions for me? No? Any questions from anyone? Does that all make sense? Can I have some thumbs up or at least one person with a nod on the screen? Yeah, we've got a thumbs up. Great, we've got some thumbs up.
So, Steve, just a quick question, because it's Mel. I missed the beginning of it. At what point do you give them midazolam? As soon as the seizure starts, or 5 minutes in?
No, so it depends on what the care plan says. If there are children, it's normally after 3 minutes. If they're an adult, it's normally after 5 minutes. So again, in that first 3 to 5 minutes, we should be doing our normal epilepsy emergency care planning, making sure the area is safe, making sure that you're observing signs of breathing, and in that time monitoring the seizure, because again there's a high chance that they're going to be sick. So again, if they're on the back, they may vomit, so you may have to turn them on the side whilst you're doing that. And equally, as we were saying, if there is a second protocol after Buccal, for example a diazepam, a rectal one, then it's important, or paraldehyde, it's important that you have specific training on those. Paraldehyde is a highly toxic chemical which can cause burns. It really smells. It's quite nasty. So you need specific training on that. And likewise with the rectal diazepam, there's protocols being bent to the side, knees up. But ultimately, you're going to be following your medication principles. So those that have done, you've all done medication training. So this is just a medication like any other. You've all done epilepsy training, so you know how to manage that, and you've all done basic life support and AED. So really, all this is, it's pulling all of that together to manage that situation. Monitor them. After that time, give the Buccal, monitor them, and then follow the emergency care plan next steps. And if you don't know what they are, it is down to you to find out, because you have to be responsible for these people. And likewise, be mindful on the dates on these. They don't last that long. They run out of date quite quickly. So if this goes out of date, it just simply isn't effective. So the dates are up in the corner. So when you've got them, the dates are there. And like I said, if you do forget what to do, the instructions are there. On your online training, so I can now see most of you are in the Sunlight group. By tomorrow, the Buccolam Training training session is live, so you'll be able to watch this video back. There's going to be a YouTube video in there doing a full demonstration as well, a practical demonstration. And then when you're doing your basic life support with Wagner, he's going to be assessing you on doing the drills as part of your basic life support. So you'll have your competencies tested through your basic life support stuff. Any other questions from anyone? Oh, and by the way, a little introduction, everyone. This is Mel, that way. I don't know, wherever you are. Mel is my assistant. She's helping me out. You're going to be hearing from her. She's also sorting out care plans, and she's helping out with training and clinical things. So Mel is an advanced practitioner nurse. She's an end-of-life specialist, dementia care as well. So you now have 2 clinical people that you can go to in cases of problems. Any other questions from anybody?
Sorry, just me again. So obviously I've never met anyone from this care, and all care agencies do it differently. Who's responsible for checking the expiry dates on all of patients' medications?
Good question. So medication management is down to whoever the person is doing the medication management. So if it's done by the family do it.
Yeah.
If it's led by the service user does it if they have capacity. But if we've done a risk assessment and we've said that the service user isn't capable or it's part of their care plan and we need to do it, then it's our carers that should be doing it. So again, all medication has expiry dates. So if we are managing medications for individuals, when we do our medications and we're dispensing and giving meds, we should be making sure that we've got them in stock and they're all in date. So again, you should be doing that, and I'm sure Wagner will probably agree that it's covered in your induction training, and when he comes out and does spot checks, they do all that as part of the audit stuff anyway. Are there any other questions? If not, what we now have in the Sunlight Care Group, where I force you all to join now, you will see the Buccolam training for today. There is a comment box. I would like you all now to leave a comment in there about the training, just to say something like, yeah, I understood it. Cool, doesn't Stephen talk a lot? Does he ever breathe between sentences? Or, you know, I'm happy with this, or whatever it is. But I would like you to leave a comment to show that you've understood the course. And then, like I said, you'll get a certificate for today to confirm that you've attended the Buccolam training. So you should know now what to do. It's not a difficult skill. It's no different to, it's just oral medication, if you like. That's all it is. So you should be able to do that. And again, there'll be a course in the My Learning bit, the one over from the discussion board where it says Learning. In there, you can find the Buccolam training and this video and some other resources. I'm going to put a care plan in there, these specific patient instructions, so you can have a look at those in more depth. All right. So thanks for attending, everyone. If there's no more questions, you are all free to go. So thanks a lot. Take care, everyone.